Midstate Medical Center specializes in the prevention, diagnosis, and treatment of a full range of gastrointestinal disorders that affect the stomach, colon, and digestive tract. Joining me now to talk about a common disease associated with the stomach is Dr. Kenneth Schwartz, a general and minimally invasive surgeon at Midstate Medical Center. Dr. Schwartz, thanks for being here.
Thank you.
So today we're going to talk a little bit about acid reflux. It seems like a big problem. A lot of Americans experience this.
Oh, it's a huge problem. Probably about 40% of the population suffers from some kind of reflux. So it's well described, well talked about, but there's a lot of treatments that people just don't know about.
And what exactly is it? What's happening to your body?
There's a natural mechanism to prevent acid in your stomach from refluxing back into your esophagus. In people with reflux disease, that mechanism is disordered. It doesn't function properly.
I see. So what would be the first step? I mean, when do you have to go see a doctor, would you say?
Well, for the majority of people, they can determine that certain foods may make reflux happen.
Right.
And seeing a doctor would be their comfort level with, are they able to control it? With, say, stop eating tomato sauce and chocolate and coffee and things of that nature.
All right. So say we have to take it to the next level. They visit with you. What would you do?
Well, most people would typically go to see their primary doctors first.
Okay.
And their primary doctor would start them on an over-the-counter medication or even prescription medication. Patients who are either not well controlled on those medications or don't want to be on medication for the rest of their lives would then come see me.
And that's where there's a surgical option.
There is, and a very good and a very effective surgical option.
So walk us through the procedure, I guess in layman's terms.
Well, I'm a minimally invasive surgeon, so things that I do are with ports and a camera, very small incisions. The operation itself would be about 2 hours long, and typically reflux can be associated with what's called the hiatal hernia. So the first step of the procedure is to fix the hernia, and the second step of the procedure is to take part of the stomach, wrap it around the esophagus in such a way that that disordered valve is now fixed.
Okay, that makes sense. And who can have the surgery? I guess it depends on the situation.
It's situational, yeah. I mean, certainly somebody who is well controlled with diet and medication and happy with that would never operate on those people. It's the people whose quality of life is truly hindered by reflux, where their regurgitation episodes, their heartburn episodes, where they just don't want to live that way anymore. Those are the people that I really would like to help.
And typical recovery time?
Well, for my patients, they're out of the hospital the next day.
Oh, okay.
Yeah. Because it's a minimally invasive operation, the postoperative pain is pretty minimal. And most people are back to work within a week or two.
I'm assuming there's probably no scarring if it's minimally invasive, right?
Well, there's some scarring.
A little bit?
Yeah.
Okay.
I use 5 incisions. 4 of them are ½ centimeter, and 1 of them is a centimeter. So the healing is quick, and it's not the same as having a midline scar. Yeah.
And all in all, it'll change your life if this is something you suffer with.
Absolutely, it's life altering. Right. Yeah. No more medication, no more dietary restrictions. Going back to what it's what it is to be healthy. Yeah.
Well, thank you for the options, Dr. Schwartz. And Midstate Medical Center is located in Meriden. For more information, you can call 1-800-DOCTORS or visit midstatemedical.org.